So Griffin is a randomized phase 2 trial that's basically looking at the safety and efficacy of incorporating the CD38 monoclonal antibody daratumumab into the lenalidomide, bortezomib, and dexamethasone or RVD backbone in transplant-eligible multiple myeloma patients. So in this particular trial, we took patients with newly diagnosed multiple myeloma who were transplant eligible, and half the patients were assigned to the control arm, which consisted of 4 3-week cycles of RVD induction therapy, followed by stem cell transplant with standard high-dose melphalan chemotherapy. After recovery from transplant, those patients went on to receive 2 3-week cycles of consolidation RVD therapy, and then they subsequently went on to lenalidomide maintenance therapy. In the experimental arm, daratumumab was added weekly into the induction therapy. It was given on day 1 of the 2 consolidation cycles post-transplant, and it was given once every 4 weeks as part of maintenance therapy up to 2 years of maintenance. After completion of 2 years of study maintenance therapy, patients were encouraged to stay on lenalidomide monotherapy as maintenance until disease progression or the emergence of unacceptable side effects. And the primary endpoint of the study was stringent complete response. Important secondary endpoints included MRD negativity, progression-free and overall survival, as well as safety. As far as baseline disease characteristics, I think it's safe to say that the randomization worked well, and high-risk patients and higher stage patients were evenly distributed between the 2 arms. I think it's important to recognize that at the time of this particular ASH update, all of the patients in this trial have completed at least 1 year of maintenance